Hello? Okay, great. Well, actually, I'll start here. So if I stand here, is this good? Okay, perfect. So I wanted to thank John and colleagues for putting on tonight's event, and John especially for inviting me to address this room. I've actually given at least one, maybe multiple talks before this group before, although never wearing the hat that I'm wearing now. It was, as has been mentioned, more in my capacity involved with atheist and humanist and secular groups, so this is a little bit different. But this is another sort of human rights issue, I think, for me, so that's what connects the dots there. So I was asked to talk a little bit about the Canadian Centre for Men and Families, which is a very new initiative. We just opened the doors actually in November, so we've been at this just a few months, although the organization goes back a couple of years. We've been hosting events and putting out public policy position statements and trying to get a bit of a conversation going with respect to the issues to do with boys, men, fathers, and families, which I'll get into. So let me start here. This is the slogan for the new center, and I thought that this would be a good headway into the theme of tonight's topic. No one is invincible. It's time he has a place for him and the people in his life. That's the slogan and sort of the call to action that we use to invite support for this new establishment that we've set up, this men's health and welfare institution. And what that slogan is getting at is the long-term vision for the center. And the vision is really to catalyze what I call a fundamental change in the relationship between men and masculinity on the one hand, and society and its institutions on the other hand. The way we see it, men and society have to meet each other halfway if we're to have any hope of making truly fundamental changes, which we hope would build stronger families and healthier societies. You might see it as a bridge. If you're building a bridge from both sides, at some point they have to connect. And in this analogy, you have men and the portrayal of masculinity on the one hand, which sometimes makes it difficult for men to get the help that they need. And on the other hand, you have society and its institutions, which aren't always available when men do seek out help. And we'll see how that plays out with a few examples. The other analogy that I was just discussing with my colleague Jeff on the way here has to do with really a paradigm shift analogy. And specifically, I'm going to use the example of changing our energy infrastructure. So right now, we're really still bound very much as a culture to gasoline and fossil fuels and dirty fuels like that. I understand your last speaker was addressing the climate change consequences of that reliance. Now, to move to a new energy paradigm, let's say alternative energy, for example, you have a kind of similar chicken and egg problem. You need, on the one hand, to recreate the entire infrastructure to replace what we have now, but you can't do that until you have, for example, vehicles which are technologically ready to plug into that infrastructure, but they're not going to build vehicles until the infrastructure is there. So you have this catch-22, and I think the same in a very different way. That analogy, I think, can hold for the examples I'm going to give you, where you have men really needing to change the way they see their own masculinity in many cases, and then you have these social institutions, and they really both need to progress. If men change their attitudes, but the institutions aren't there, that's not going to work. If the institutions are built, but the men aren't ready for them, then nobody's going to use those institutions. So this is really the challenge at the core of the center that we've just gotten off the ground. So when it comes to men, I've said that those attitudes needs to change, and really what I'm talking about is men learning to accept vulnerability, learning to accept that it's okay to need support, it's okay to seek out help. And on the other hand, society needs to learn to accept that men will be asking for help, that men's issues should not be trivialized as unimportant or dismissed entirely under the old notion that men are the cause of all problems and not worthy of concern. So both sides need to come together, or progress, in my opinion, will be elusive. And I'm going to give a few examples, and that will be sort of the thrust of my presentation, a few examples about how this could play out. And these will be examples I'm using because they relate to programs and services that we're either providing at the center or which are goals for the center. So let's take sort of the bread and butter for us, which is men's health. men's emotional well-being, which is a most basic area of concern for us. Men are, according to research reports, less likely, significantly less likely than women to seek out help for their healthcare needs. There was a provocative article in the American Psychological Association journal in June 2011. It was entitled, "Why Do Men Die Earlier?" which is something we all just kind of take for granted. And in that article, a health journalist by the name of Bridget Murray Law explains that men are 25% less likely to have visited a healthcare provider in the past year, and almost 40% more likely to have skipped a routine and recommended cholesterol screening. The results, she goes on to describe, sort of speak for themselves. Men are 1.5 times more likely to die from heart disease, cancer, and respiratory diseases, and again, to die on average 5 years earlier than women. Now, these facts are often waved away as simply due to genetics alone. But it turns out that it's a more complicated intersection of genes and behavior, as is the case with most things. So, for example, Gilles Tremblay, who's a social work professor from Laval University in Quebec, has argued that of those 5 years, quote, 1 year is biological, but the rest is cultural, end quote. Tremblay's work suggests that it's socialized masculine traits like emotional suppression, aggression, and risk-taking that lead to fewer healthcare visits and a higher rate of injury and disease. I want to also quote from Ronald Levant, who's a former president of the American Psychological Association, who's a little bit more blunt. He says, quote, "Masculine gender socialization is hazardous for men's health, posing a double whammy of poorer health behaviors and lower use of health care." So again, you see how both of those consequences, how they relate to that socialization, both the use of the healthcare services that are there, or the underuse, I should say, and also the different socializations that men bring to their role as men, the way they see their need for these social institutions. I think it's already fairly well established that men are significantly more likely to die of preventable deaths. So now I'm talking about suicide deaths, about workplace suicides, about death on the battlefield. So if we look at some of the numbers here, I mean, they're actually quite stark. Men are 75% of suicide deaths, they're 81% of war deaths, 97% of military combat fatalities. And this one I find really staggering. Men, or of those who die on the job, something like 90% or more, I think it's about 93%, are men. 93%. That's quite an asymmetric figure there. So we know that behind these shocking numbers of what I would describe as preventable deaths, things like homicide or suicide, that male socialization, not just biology, but socialization, is a major factor. What we're learning, though, now is that male behavior factors also account for more than just these so-called preventable deaths, that a broad range of negative health outcomes may be preventable if men cared more about their own well-being. It's tragic to consider, but I think that there is some hope. Behavior is, of course, more malleable than genes, so we can actually affect behavioral change a lot easier than we can change people's genetics. So we'll get back to that in just a moment. But one way I think to change men's willingness to seek out help is, again, it's to challenge and ultimately redefine the perception of what it means for men to be strong. Being strong is sort of a quintessential value that men tend to prize, but being strong can be interpreted in different ways. So currently, some of these researchers will tell us that men don't go to the doctor because the way they interpret being strong is by avoiding help, as toughening it out or being stoic. And this was the case from some research that was done by two men's health sociologists. They were actually interviewing physicians on this phenomenon back in 1999, asking physicians why they felt that men weren't coming to see them as often as they should be, and that was what they heard. What I think we need to do is we need to sort of redefine what it means to be strong. So another kind of strong or strength might be doing that which you find difficult to do. So if for many men appearing vulnerable or going to the doctor and admitting you have some sort of ailment, if that's what's difficult, then doing that anyway, sort of pushing yourself to do that difficult thing, in this new formulation, that can be the new way we interpret strength. And that could be one way to use the concept of strength, which is not a bad value in and of itself, but to interpret it in a way that's a positive for men's well-being. Now, on the other side of this equation, when men do reach out, they need to find a set of receptive institutions. So this is the other side of that bridge. And the problem in men's health, which I've just been describing, needs to be tackled head-on by our healthcare institutions, because there are far fewer healthcare agencies that are set up for men. I've searched, it's hard actually to get numbers on these admittedly, but I've done what I could. So I looked, for example, for registered Canadian health charities registered both as healthcare agencies, which is one particular designation as a charity, and those that have a gender focus. And what I found was that there were 13 set up for women and 1 for men. These were on the Canadian Revenue Agency's website, so 13 to 1. I also visited Toronto 211, which provides a pretty comprehensive list of services that are available in the city of Toronto: social services, community services, healthcare agencies, that kind of thing. And what I found was that there were 27 entries when I searched for men's health. There were 92 entries when I searched for women's health. So I actually called Toronto 211 and I asked for all of their men's health listings. I wanted to make sure I wasn't leaving any out. And the response that I got was kind of interesting. All they could refer me to was sex clinics. So when I looked for women's health, I found breast cancer, osteopathy, obviously a lot for pregnancy and reproductive health and that sort of thing. But when I looked for men's health, when I called and asked for men's health, it was sex clinics that I was being referred to. So I also checked into the Toronto Community Care Access Health Line, which is set up to refer residents to healthcare services in their neighborhoods, sort of to facilitate the connection between citizens and the healthcare agencies. And there I stumbled upon a page which listed 24 agencies dedicated to women's health under the heading Women's Healthcare Centres, 24 just in the region of Toronto Central. The website was divided by region in Toronto. There was not a single page for men's healthcare, so I called their office and I was told I had never seen a men's healthcare center listed. So 24 for women, and I had never seen one for men. I mean, that's what I was told by whoever picked up the phone. You can make of that what you will. Now, I also spoke to a couple other people there because I wanted to get to the bottom of this. And finally, we did manage to find some services available to men, although none of them were dedicated men's health centers. They were really mostly private clinics, again, overwhelmingly dealing with sexual dysfunctions, which are important, don't get me wrong. But whereas women, again, had things for cancer and life skills and eating disorders, none of those were dedicated to men. Let me just pause there on eating disorders as an instructive example of this healthcare disparity, because 1/3 of all diagnosed cases of eating disorders are now men who are being diagnosed with eating disorders or body image disorders, which is quite different from, I think, the stereotype. Within the last year, a Toronto social service agency which is dedicated to assisting those suffering from eating disorders, called Sheena's Place, acknowledged this gap, acknowledged the fact that there were lots of men being diagnosed with eating disorders, but very few places for them to go. And they, Sheena's Place that is, launched a men's initiative where they rebranded themselves in order to attract men into their program. And they actually launched a men's program, an explicit men's program within Sheena's Place. So Sheena's Place is a really good example and is very praiseworthy. They've been operating for 15 years or more, and in all of those years they had done some great work, but they had attracted 2 men, hundreds of women, but 2 men. So they acknowledged again that if we're going to bridge the gap, then the existing institutions have to, pick up some of the slack. So you got to get men into these programs, but you also got to get these programs rebranding themselves to be open and welcoming to men. So a small institution like the Canadian Centre for Men and Families, the establishment that I'm associated with, obviously we can't single-handedly make up for the lack of programs for men. But our approach is to serve as a hub, as a catalyst for changing social attitudes, and we can work with existing organizations like Sheena's Place, who has come to us for our assistance. We can leverage our limited resources in all of these ways, I think, to make more of a footprint in terms of fundamental long-term changes. So enough for men's health for the moment. I think that's the most obvious, but it's not the only area where these two sides, men and society, are currently far apart. Another is in the domain of fatherhood and the father-child bond. Children, I think we all know, are often the biggest casualty when it comes to the breakup of families. And one of the most common ways in which a child suffers is through something called parental alienation. Parental alienation is more and more being acknowledged as a form of emotional child abuse, where a custodial parent routinely belittles and vilifies the other non-custodial parent of the child. And certainly both mothers and fathers are capable of being the so-called favored parent and alienating their child from the other parent. But for a variety of reasons, we do see this effect to be one that's gendered, with the father significantly more likely to have his bond with his child compromised or even broken by parental alienation. In the extreme case where a child loses access to his or her father altogether, the consequences of fatherlessness can be rather severe. So research after research after research shows that even when we control for socioeconomic condition, growing up fatherless is correlated with a host of negative outcomes, from high rates of suicide and teen pregnancy, to behavioral disorders, to a higher likelihood of winding up behind bars, of dropping out of school, and of entering abusive relationships. Now, the tragedy here is that here we have average fathers who desperately want to be a part of the life of their children, and society is still very often stuck with this outdated and sexist notion of the deadbeat dad. These fathers need to take action for the sake of their children. They need to be more proactive in reporting parental alienation to the family law courts and the children's aid societies, and they need to form groups to make change happen, and some of that is starting. But on the other side of this bridge, society needs to not so quickly dismiss parental alienation because it might make mothers look bad, or out of some sense that men only want to be a part of their children's lives as a way of controlling women. These are exactly the kinds of really old-fashioned beliefs that keep men's issues trivialized and safely out of the way. It's, for example, why every province in Canada has a special agency to enforce the payment of child support. Here it's called the Family Responsibility Office in Ontario, but not a single province or territory has any agencies or programs to enforce custody access. That needs to change too, and that's where the institutional change has to happen. So, talked about men's health, we talked about fatherhood and the father-child bond. A couple more examples I want to give before I wrap up, and so let me move on to the third area, which has to do with boys and the educational achievement of young males. And this is the so-called boys' crisis in education, which is getting more news coverage these days. Back in 2010, and since you'll be reading quite a few articles in the Globe and Mail in particular has been covering this, but back in 2010 they started a series. It was a 6-part series in that particular year called Failing Boys. And what they did was they demonstrated through a number of studies that boys rank behind girls by nearly every measure of scholastic achievement. Boys earn lower grades, both in elementary and high schools. They trail in reading and writing. They're more prone to behavioral problems in the schools. They're more likely to repeat grades and to drop out of school altogether. We know the fact of the under-enrollment of boys vis-a-vis girls in post-secondary education. These trends were studied extensively by Dr. Paul Capon of the Canadian Council on Learning. He issued a report in January 2011, which he did for the OECD. So he was looking really at Western developed countries. We'll talk in a moment. Well, actually, his research acknowledges the difference between OECD developed countries and so-called developing countries, where there is still a real issue with women's access to education. That's something that deserves our strongest attention. But in particular, when we look at these OECD countries, the more developed countries, we do see the so-called boys gap, especially when it comes to literacy and reading skills, which was his primary area of focus. And here again, the problems are both on the side of men, or boys in this case, and society. So let me explain what I mean by that. Boys, on the one hand, really need to change their attitudes towards learning. Boys are socialized to perceive reading and education as girl activities, and must take the initiative, boys must, to reorient themselves to appreciate the importance, utility, and pleasure of literacy. But on the other hand, teachers, who in this case are, in my analogy, sort of standing in for our institutions, teachers must meet these boys halfway. So teachers really need to raise their expectations of boys, You need to find ways to raise their self-confidence, the self-confidence of boys. You need to find unique ways to raise male interest in reading and learning. The government and academic institutions have started to awaken to this problem, and we have seen over the last 7 or 8 years the Ontario Ministry of Education doing some pretty important work. So in particular, the ministry worked with the Ontario Institute for Studies in Education out of the University of Toronto on something called the Boys Literacy Teacher Inquiry Project, which was undertaken between 2005 and 2008, and it's been continuing since. And the idea with the inquiry project was to identify strategies that teachers could use, which were designed to increase boys' engagement and appreciation for literacy. Also, resources are starting to be mobilized to assist teachers on a day-to-day basis in reaching boys. So that's all good stuff. But more work really does need to be done in this area. The focus has been on reading for valid reasons. That's really where boys are struggling. But boys' attitudes to learning more generally has not been addressed, and that's a core problem. There has been very little focus on post-secondary education, where the gap has been widening for years in terms of enrollment between men and women. There are few efforts to recruit or mentor men who are interested in traditionally female-dominated fields like nursing or early childhood education, which I think is vitally important if we're going to open up professional options to both men and women and tear down professional barriers to women going into traditionally male fields or men going into traditionally female fields. We need to be tackling both of these kinds of professions. I'll give you one example of an exception to this rule, which I think is quite interesting, and that's a Calgary-based initiative called the Nursing Guys Club, the Nursing Guys Club. So it was set up to deal with the societal stigma facing male nurses, to borrow the phrase from Tyler Hume, the group's founder, who is himself a nurse and himself faced some stigma being in that profession. According to a study in the American Journal of Men's Health, male nurses are still viewed as less masculine than men in other professions, while interestingly 33% more male nurses have been physically assaulted by a patient compared to female nurses. Now, if the low male representation in nursing is something to be concerned about, let's also consider another profession, early childhood educators. The Toronto school boards, both the secular and the Catholic boards, have early childhood educators that work in the school system. There's 755 of them, at least there was as of 2013 when I read some reports about this. So 755 early childhood educators. How many do you think are male? I was just going to read it out, but I'll ask the question. Out of 755, there's more than two. Less than 100, so it's somewhere between 2 and 100. Anybody else want to guess? Less than 70. So it's 22. Okay, so 22 out of 755. So I am borrowing this, as I said, from some articles, some research that I did, and in particular, the Toronto Star was very good and covered, did a couple of articles covering this phenomenon, I guess, of men actually entering early childhood education, because it actually was less, it's probably two, a few years ago, so things are improving. And they read an article covering this, and the article was called "Men Stand Out as Daycare Workers," and I thought this was interesting. So they went and they interviewed a woman named Julia Littman of the College of Early Childhood Educators to ask her, what accounted for this discrepancy and whether this was a concern or whether she was going to do anything about it. And so what she said was the following quote: "Since the college's inception, the College of Early Childhood Educators, the number of new members each year who identify themselves as male has consistently been observed at approximately 1% of the total membership, 1%. She goes on to say, "We are focused on the public interest and professionalism and do not take gender into account, although it is an interesting question," end quote. Now, think about this. In fields ranging from engineering to physical sciences, we have aggressive efforts long underway to recruit women into these traditionally male-dominated fields, which is great. I think we should keep those up. But why should the same initiatives not extend to fields traditionally dominated by women, especially fields like early childhood education and teaching and nursing, where society, I would argue, would be well served to have more men? Police departments, we see a lot of this, take great pains to ensure that their police departments represent the community, including being sensitive to gender in their hiring preferences. They want to reflect the fact that our society is, roughly 50-50 men and women. So given the influence that early childhood educators and teachers have in the lives of young children, and given the oftentimes lack of male role models at home, remember the fatherlessness we were just talking about, and given the boys' crisis in education, which we just addressed, is it not at least as important in these professions that they represent our community? Is 1% of early childhood educators really reflecting our community? Dr. Rebecca Coulter and Dr. Margaret McNay, both Western University professors, found that men face suspicion from both parents and fellow educators when they show an interest in a profession that involves them with young children. So again, society's attitudes and institutions need to change to meet these male pioneers halfway. And just quickly, the last area I want to touch on is violence. And in particular, domestic violence, sometimes called intimate partner violence. And again, I want to do this by bridging that gap between men and masculinity on the one hand, which is my entire theme for this talk, and society on the other hand, because I think that this is really the core of why we haven't made a lot of headway thus far. So on the one hand, when it comes to domestic violence, we have some interesting statistics which, well, I'll throw them out to you, and perhaps you can give some thought as to why they are not consistent with each other. So here are the two figures that I'm going to quote. On the one hand, we have Statistics Canada figures on domestic violence. And what these show, and have been showing for the last 20 or 30 years, is that comparable levels of men and women have experienced victimization of one kind or another by their partner or their spouse. It shows that about 7% of women versus about 6% of men, so a slight difference, but not a whopping difference. 7% of women and 6% of men have experienced some form of domestic violence. Yet, here's the other figure that I want to throw out, which is the rates at which men and women actually report violence to the police, fill out actual reports, go to the station or call up the police, or take some actual action to do something about these attacks that they're experiencing. And in that case, 83% of cases of actually reporting violence to authorities are from women victims and 17 from men. So why is there that disparity? That's something that I want you to consider. One problem, I think, and again, this is where the social institutions need to change. So men need to change in the sense that if they're experiencing violence, they need to report it, they need to take action, they need to not just sort of take it like a man and do nothing about it. That has to happen. But then the other question is, well, if they do report it, what kind of reception will they get? And so here, again, looking at the police, looking at, as I was just saying, the report instances of men versus women, what would happen if a man were to report that he was a victim of violence to the police? What kind of reception would he get? Well, if you go to the Toronto Police Domestic Violence website, the first thing you read is women who have been victimized by violence are a Toronto Police Service priority. Just women who have been victimized. And there's nothing on that page that even refers to the existence of male victims. We also know that in some jurisdictions there are sort of protocols in place that if a domestic violence call comes into the police, they are to remove the man from the house, or in some cases they're to remove the taller person from the house, which is really just a way to not put gender in there, but in effect to take the man, or the proxy for gender, if you will. So we have these protocols in place where society's cues are that if you're a man, you can't really be a victim of domestic violence. And that's probably part of the reason why men aren't reporting violence, because they're more likely than women to be laughed at, to be trivialized, to be dismissed as not real legitimate victims of violence. So again, that bridge has to happen. Yes, men need to change their attitudes, but if they do that, social institutions have to also be adapting and entering the 21st century. And there are actually some good stories. So I mentioned Sheena's Place as an example of an organization that's really praiseworthy in terms of providing healthcare support to men, recognizing that gap. There's another good example in this area, and that's an organization that our center is connecting itself with, called the Canadian Centre for Abuse Awareness. And they kind of had an interesting, I met with their director, and she gave me some interesting stories. She's a remarkable woman named Ellen Campbell. She herself was the victim of male perpetrated violence, And yet in the work that she's done, despite the fact that the CCAA, that their marketing is really for female victims, which they do because their sponsors really tell them to do that, because their sponsors frankly don't want to sponsor programs that are seen as supporting male victims, which is a sad state of affairs. But yet her work has been to bring the same level of support to both male and female victims, because in her work she has seen that men are visiting her center, men are contacting her. Again, even though the marketing isn't suggestive that they really care anything for male victims, men have no place to go, so these male victims are contacting her, and they have found a receptive audience when they reach her. So she's a remarkable woman, and her organization is a really praiseworthy one, and I'm pleased to say that we will be working with them, it looks like, on a male victimization conference at the end of the year, something that they used to do on a regular basis with support from the Ontario Provincial Police. So that was good of them. And it's something that kind of stalled a few years ago for a variety of reasons, and we're looking to restart these conferences. So again, an example of how our center can't do all that much given the modest budget that we have, but working with other really important social agencies, we can leverage the limited resources that we do have. But I guess just some concluding thoughts, because I've given you some examples. We've talked about fatherhood and the father-child bond. We've talked about men's health, emotional and physical well-being. We've talked about domestic violence. We've talked about the so-called boys' crisis or boys' gap in education. And my theme for the evening has again been not so much to blame people, because I don't think that's very helpful, but to see the problems that we have and to look for solutions. I'm sort of a problem-solving oriented kind of person, so I don't care to blame anybody. My interest is in, are there problems? Does the research suggest that? Then if so, what are the solutions to those problems? And I think that the solutions have to come again from this bridging. Men and their social attitudes, and then society and its institutions meeting each other halfway. And so my last point is just in terms of the overall goals and the visions for the Canadian Centre for Men and Families, our interest again is in catalyzing that change, bridging that gap between men and society, and at the bottom, at the core of our interest, it's a public education and awareness campaign. We can't only reach men or only reach society, so our message really has to be taken to both sides of this problem to try to bring them together through the programs that we do, through the networking that we do with some of the agencies that I've named in my presentation, and just by getting the word out in all sorts of ways, providing forums where people who have these kinds of issues that I've been describing, and then leaders of social service agencies, community leaders who have to date focused largely on women's social services, can come out and find ways to expand the programs that they're doing, oftentimes excellent and praiseworthy programs, but expand them to do a better job to bring those programs to men and to show men that those programs are there for them. So that's our goal. I'm happy to take questions. I didn't get into all the different areas that there are services or whatever, but I want to give you more of a sort of big picture philosophical concept for why we exist and what we're trying to accomplish. And Denise is reminding me that we also have some materials there from the center. Well, these are my friends from the center. This is Denise Fawn, who is our communications and outreach coordinator, and then Jeff Stone, who does some of our multimedia and podcasting work. So yes, some questions.
I'd like to, I guess, point to see various areas you talked about. Preventable deaths. The rate of smoking for men is higher than women, although women are not. So the rates of lung cancer for men are higher than for women.
Right.
But there are a number of health organizations like the Heart and Stroke Fund, the Arthritis Society, the Alzheimer's Society, the Lung Association that are non-gendered.
Right.
So men and women can get advice and treatment from those organizations. And in the issue of literacy for boys, the Harry Potter books did more to turn boys into readers than any other single books. And about the absent fathers, urban families, black families particularly, have a high rate of absent fathers and mother-led families. And huge problem in the Black community, particularly in the centre of Toronto.
Yeah, those are all great points. And just on the last point, I take a moment, I've mentioned a few praiseworthy agencies. There's also another one I didn't mention called Black Daddies, which is a group in Toronto. It's set up in some of the Black communities in Toronto, where there are socioeconomic disadvantaged conditions and that kind of thing. And it's a group that was set up by some community leaders to provide tools and resources to fathers, absent fathers, or fathers who were sort of in danger of becoming absent fathers. And I'm happy to say that the City of Toronto has actually not just endorsed this project, but actually has started to fund it with some trial funds to see if the program can grow and become a stable part of the community and have some positive effects. So I agree with the points that you made, and I'm glad to see that there are some initiatives that are starting to fill those kinds of gaps. But obviously, a lot more has to be done. Of course.
The one thing which we want to go back in the Western society, our society, we go back about 100 years. Males, they were domineering 100%. I mean, what the father said, the man said that was go. Now it seems to be going the other way a little bit too much. Like you say, we have all these female organizations and all, and so I don't know what happened there.
Yeah, I mean, I don't really see it so much as like a pendulum swinging. I mean, people like that metaphor. I'm not sure I would agree with that. I think there have always sort of been areas where men have been sort of more likely to suffer. So in the past, there was a high likelihood of a woman not surviving childbirth, right? Amazingly high, actually. There's a high likelihood a man would die a violent death, even higher than it is right now. Men were drafted to war, etc., etc. So again, I don't find as interesting, the debate about who had it worse, where and when in history. I'm more interested, again, are there problems in 2015 in our communities? If so, what do we do to solve them? And who can we partner with? Can we partner with women's groups? Can we partner with LGBT groups? Can we partner with other social justice groups? It's a pragmatic approach, right? So it's not ideologically driven or blame driven or anything like that. There are issues, and it's not to take away from other groups' issues, they exist too. But these are issues that aren't getting a lot of attention or a lot of support. And so, let's fill that gap. Let's do something about that. Let's do it in a collaborative and constructive way. I forget who I saw first. I think I saw your hand first.
I'm wondering how you're funded. And related to that question, you're getting funding from Gordon Peter's very dear friend, Stephen Harper.
Oh.
Say that.
Right. So how are we funded? The answer to that is not. We don't have a lot of money, and I mentioned a few times that our budget was modest. It's entirely privately funded right now. So we launched a capital campaign back in 2013. We spent about a year raising support, getting people excited and raising funds through auction events, through donation drives, all sorts of things. It was difficult enough just to sort of reach the capital fund goal, which was modest, but we were able to do that. And so that's what allowed us to open the doors in November. And then, since then, we've always been sort of continuously fundraising, as all charities have to do. But really, the funds we have are just enough to keep the center going, to have some basic programs. We have some great programs we'd like to add to the mix, but those will continue to be dependent on more funds to grow the program. So it's very modest. It's a shoestring budget. At this point, everybody's still a volunteer, although hopefully we'll be able to sort of institutionalize and professionalize our establishment in 2015. But it's been quite difficult to just sort of to market the idea, because it's a very new idea, and people legitimately with new ideas, they have concerns, they want to see that you have credibility, and so that takes time to build. It's going in the right direction, and we're certainly making progress. But yeah, as far as funding goes, that because we're breaking into new ground, that has and probably will for some time be a challenge. As to Stephen Harper, well, I did say I would take support wherever I could get it, but there were some strings attached to that sort of
ideology there.
Yeah. Well, in terms of accepting support, whether it's funds or volunteers or whatever, we are not an ideologically driven organization. So we have volunteers working with us who are both men and women, who are both gay and straight, who have a broad range of views when it comes to all sorts of issues, economic issues, social justice issues, what have you. What they share, though, is they want to solve these problems, and so that's the pragmatic approach that I was describing.
Do you at least have a charitable registration?
We do have a charitable registration. Yes, ma'am.
I hate to confess this, but I have always pictured in my mind when you have the word pedophile that it's a man. Is that totally out of sync with that?
Yeah, I think a majority are men, but you'd be surprised by how by the percentages. It's not 100 and 0. It's also not 50-50. It's somewhere between those two. But yeah, definitely the perception is that if you hear pedophile, you think of a man. And very often, when you hear stories of what would otherwise be described as female pedophiles, situations where women have taken advantage of their positions of authority, let's say with youngsters in school or in correctional service institutions, that kind of thing, they'll often kind of be shrugged away, like, well, the boy enjoyed it. He wanted. How could you complain? Which is pretty damn offensive, actually. It would never fly the other way around, right? But we're still kind of in that old-fashioned mentality that, again, boys can't really be victims of sexual violence, but actually something like 1 in 6 men have been victims of sexual violence or sexual assault of one kind or another. There's actually an organization called 1 in 6, which is dedicated to raising awareness of this fact and providing support to male victims. So it's definitely not 0, but it's probably not 50-50 either, to be fair about it. Sure.
Do you have any numbers for human ages? Are they 50-50 male or female, or which is there any difference at all? Or?
I think I read a statistic recently that more women are members of a religious institution. Did you read that? You probably did. I don't think it's a significant difference, but I think that there is a slight skew towards women being members of religion. I don't know about beliefs, though. Women do tend to be members of lots of organizations, social service organizations or clubs or what have you. So that could explain. It's probably more of a sociological explanation than it is really one of psychology or belief. But I'm not gonna speak more than that because I really don't have the statistics to back me up. Yeah. Yes.
I applaud everything your group is trying to do. I wonder if the United States or Sweden or Norway or Holland, Belgium have been working on the same kind of initiatives, or do you know?
There are. It's kind of scattered. I think Australia actually has been rather advanced. Jeff, do you remember this? We've been doing some correspondence with some groups in Australia. There is, for example, an Australian Institute for Men's Health, which is kind of pioneering this effort. Actually, they had, I think it's kind of an abortive attempt, unfortunately, to get a male studies department opened at a university in Australia. It was kind of torpedoed, the initiative was, by miscommunication and misperceptions about their intentions and stuff like that, which is an unfortunate side effect of some of the work that men's issues groups do, or issue groups that are focused on men's health. But they have really been pushing on not just blogging about this or doing podcasts about this, and you'll see a lot of blogs and podcasts about men's health and men's issues, because that's kind of an easy entry point to get your message out there. But they were actually wanting to institutionalize it. So they thought it would be neat to do that by establishing a headquarters at a prestigious university in Australia, where they would have professors and staff, faculty dedicated to men's health and other areas of men's well-being, like the others that I touched on today. And like I said, it was an abortive attempt. I think it's still in development, but it did get kind of sidetracked, unfortunately. So that's an example that I'm aware of. Otherwise, the situation is not too dissimilar from country to country.
Movember started in Australia by
Oh,
men's
that's
group.
Movember. The prostate cancer. Well, now it's more than just prostate cancer. They're interested in men's mental health and other health issues as well. And they set up a foundation that funds a number of very important men's projects. But they also were launched in Australia. So I don't know why, but that good things come from down under, I guess. Yeah.
I guess along the same lines, do you have any numbers that other societies that are much more male-dominated, male pride, have much more male pride issues than we have?
Yeah.
Do they fare worse than in terms of health?
Yeah, that's a good question. Like societies that are more sort of macho in their orientation. Give me examples of societies you're thinking of.
Saudi Arabia or
Right, yeah.
Okay.
Saudi
So patriarchal societies. Yeah, I don't. Those countries like Saudi Arabia tend, on average, to have significantly lower socioeconomic conditions. Not the elites, of course; they're wealthier than God, but the average citizen. So I think that would kind of skew the comparison, which is why I mentioned earlier that a lot of the work on education was really focused on the OECD countries, the countries that are like the top 20 or so in terms of socioeconomic, quality of life indicators, all that kind of thing. Because if you're looking at the developing world or the Middle East in particular, then yeah, I mean, there's no doubt that women face barriers to Africa, a lot of countries in sub-Saharan Africa, women face serious barriers to education and to getting the same opportunities as men. So nobody's denying that. And he acknowledges that at the beginning of his report, the Canadian psychologist who studied this that I was referring to. But then when you do look at the Western countries, that's where you do see this trend, which is really interesting. And there is a real common trend between countries. So despite different jurisdictions having quite different approaches to education. I mean, in some places it's all public education, other places it's all private education. Most of the OECD countries it's a mix of public and private education, and yet you still see this trend despite the different education models that hold in these different jurisdictions. So something is definitely happening there that cuts across the different education models that have been employed. But again, it is looking at Western countries, and I don't have the statistics on the rest of the world. Yes, at the back.
Before I came, I Googled you and the Canadian Association for Equality.
Yeah.
And I ran into this kind of wall of hostility from various feminist groups in Toronto. Apparently some of your things on campus have been, involved with police getting called because of riots and such. I'm just wondering, I haven't heard anything tonight that would justify that level of hostility. Are you kind of getting guilt by association with some other groups, or
I think that's
any
part
idea
of
what's
it.
going on? Is it just this? Well, I'm sure you've Googled yourself and you've been there. And
Never.
there's this tremendous blast you get.
I did it a few times, and then I haven't since because there's a lot to read that I don't want to read. Yeah, it is largely a guilt by association kind of thing. But what I've noticed, it's not just our organization. So, unfortunately, one of the challenges we face is that as soon as you put sort of men in the title of your organization, and Canadian Association for Equality doesn't have that, but the Canadian Centre for Men and Families does, but we're very clear in the name and in the branding that this is a center for men and families. If you look at who's involved, you see a lot of women working with us at every element of our organization, the board of directors and the advisory fellows on down to the committee chairs, and there's a healthy representation of women. In fact, we've had young female students running a number of our so-called men's issues awareness groups at the universities to talk about the university settings that you're bringing up. But yet, even as soon as you put men into the title, you get associated with the most extreme, vile men's movement organization that's out there, right? So the way it works is that if you want to be hostile to men's issues, what you do is you just equate any group that you want to slander as a extreme men's rights organization. Then you point to an actual extreme men's rights organization and you say this is what they do, therefore all men's groups do that, therefore we can dismiss this group. Which of course you wouldn't do that with feminist groups, right? There are certainly extreme
Oh, yes, they
feminist
do.
groups. Right, but if you do that, you'd be legitimate to point out that that is a flawed logic, right? It's flawed to associate every group with the most extreme sort of caricature of the movement, right? So yeah, of course, if you want to be an opponent to feminism, you would probably do that, but you're likelier to be called out for that kind of logical fallacy. Yet that happens in the pages of mainstream newspapers, and nobody, or rarely does that get subsequently called out by other journalists or other letters to the editor, what have you. So sort of the last word on it is this organization is to be equated with, again, these really extreme characterizations of what a men's organization is all about. So we face that battle. But yeah, I mean, you're right to point out that in all sort of social movements, that is a risk, right? There's a risk that when you have a spectrum of groups within a movement, that groups that are legitimate and sort of moderate and everything will be conflated with the extremes on one side or another. So we face that like other groups have. Yeah.
And one other question. Well, you mentioned sort of an equation between male violence and female violence. I know one study, I can't remember where it was, but suggested that that's true at a kind of lower level, where the proverbial wife hits the dish over the husband's head or whatever. But when it comes to serious things like murder, I think that there's still a lot more men murdering women than the other way around.
Well, it's about 2 to 1. Yeah, murder is about 2 to 1. It's obviously the most extreme kind of violence. Although I would call using a weapon and bashing somebody over the head as a pretty serious kind of violence. Most domestic violence, whether perpetrated by men or women, is not that severe, right? So of course all violence is deplorable. But if you're bringing up the issue of the severity of the violence, whether it's male victimization or female victimization, it is there's more of the less severe kind, if you will, and less of the more severe kind. So, regardless of gender, that's true. But even when you look at the more severe kinds of violence, they're fairly comparable. And when you talk about murder, well, it's about 2 to 1. And very often, women won't themselves murder their husband; they will get a third party to do that. There's a very famous case of a woman named Nicole Doucette, who tried to have her husband murdered on a few occasions. Some of you may have heard of this case. So she hired a hitman to do this. Unfortunately for her, the last time she tried, the hitman ended up being an undercover RCMP officer. So she was charged with attempted murder, or whatever it is. Anyway, she argued sort of a version of the battered woman syndrome, that she was, living under this culture of fear because her husband was an abusive husband, and therefore she was under duress. That was her defense. And at the lower court, she actually won that defense, but it was appealed ultimately to the Supreme Court of Canada, which returned a verdict, an astounding verdict in the last year, 16 months or so, where they decided that the defense of duress was an illegitimate defense, but just kind of on technical grounds. They never questioned her allegations that she was doing this because she was a battered woman, and so what they did was, even though they couldn't accept the duress defense, they accepted that she was a battered woman who was living in a culture of fear, and so they let her off. They stayed the proceeding. She didn't face any jail time for trying to have her husband murdered a few times. To, sort of make this even more ridiculous, her husband was not allowed to testify in his own defense, right? So the proceedings were stayed on account of her allegations that she had been victimized by him, even though there were lots of holes in her story. And on many of the occasions when she claimed to have been victimized, he was nowhere near her. Like, he had alibis that he was not even in drivable distance to her that evening, for example, even though she had a history of having been violent against members of her own household who were prepared to testify. They were never called to testify. Her husband, Ryan was his name, was never called, Michael Ryan, was never called to testify. So the Supreme Court let her off. And so I'm kind of going on an aside here, but there you have an example, just an anecdote, it's one example, where you had a woman who didn't murder her husband, but tried to have him murdered, and that won't count as a statistic because she wasn't actually convicted of anything. So anyways, that's just an interesting aside. But back to your serious question, yeah, even when you look at comparable levels of severity of violence, they're not as far apart as people tend to think. And certainly when you look at what constitutes the bulk of violence or domestic assault of either gender against the other gender, they are extremely close. And the other thing I should say, and then I'll move on, is that very often what gets overlooked is in many cases, perhaps the majority of cases, there isn't a simple perpetrator-victim sort of binary. More often than not, you have a dysfunctional relationship where both partners are hitting each other. But we're sort of primed to look at domestic violence in this very simplistic way. There's an interesting woman named Erin Pizzey, who was behind the original movement to open shelters for abused women, and did some very good work, sort of raising the alarm on abuse of women, which wasn't taken very seriously until 3 or 4 decades ago. And yet, in more recent years, she has come out championing the need for shelters for abused men and talking about how, in her experience, the majority of what she witnessed was mutual violence. It didn't fit the simple binary pattern of male aggression against women. And she's really been shunned. She's just been completely ostracized by her former friends in the feminist movement, in the movement to support female victims of violence. So, again, my theme of the talk is not to place blame, it's just to get people who need help the help that they need. But there are serious impediments to that effort along the lines of some of the knee-jerk reactions that people tend to have when you bring up these, what I think are these important issues.
One of the reasons that fewer men go into early childhood education is because it's traditionally a low-paid area.
Yeah, that's a fair point. That's a fair point. Well, like I said, it's got to come from both directions, right? It's not acceptable that teaching or nursing or early childhood education is not a profession where you can sort of support a family, right? So that because of sort of, again, socialization, that men are breadwinners, women are to stay at home and take care of kids, which limits the options for both men and women, limits the options for families in general. We need to find ways of rewarding people for going into important professions and giving people the options so that whether it's men or women who want to go into these vital professions and want to support their family on the salary of those professions so that the other gender, whether it's the man or the woman, can stay at home and raise the children, the child, the salary should be commensurate so that can be accommodated. So I'm with you on that, absolutely.
I see what you're trying to do at this point as such a grassroots thing, but I equate it back to the early 1900s where women were trying to get the vote.
Right.
And it has taken 100 years for there to be, as a teacher, whether I was female or male, I got the same salary. And it took a long time to get to that.
Yep.
But what you are trying to do, I can see not coming to fruition for another 100, because you're trying to change society.
Yep.
I have grandchildren now. I have a little 2-year-old grandson, and both of his grandfathers, he's a very timid little boy, and when he shows fear of something, both of his grandfathers say, "Cut that out, what are you, a little sissy?" And both of them have the attitude that this 2-year-old shouldn't be afraid of anything, and to be a boy, he's got to be, they have to change their attitude. But for them to change their attitude, it's going to take, I don't know if they will, but we have to change our attitude, and we have to change the next generation and the next generation. But I can see what you're trying to do, but it won't come to fruition in my lifetime, I don't think.
No, probably not mine either.
No. But I applaud you for doing it.
Yeah, no, I appreciate that, and I think you're quite right about that. From our point of view, those of us who are interested in this, we look at how can we be as effective as possible, both now and in terms of the long-term future, knowing full well that we can make some immediate gains in this or that area, but if we want to, over maybe a century or more, affect long-term change, it is the social attitudes that have to change, just as you're saying. And so that's why I'm so focused on making that a real core of what we're doing. So at the center, we do respond to the urgent needs, because in some cases, these are life and death needs people have, so we want to fill that immediate gap. But if that's all we do, it's the teach a man to fish versus feed him fish analogy. I'm full of analogies tonight. I'm not sure they're all completely appropriate, but I hope that one was. But over time, you want to raise that education, that awareness, which is why that's just as important as providing the immediate services for us.
Good for you.
Oh, well, thank you. I don't think you've asked a question yet, so do you mind if we go there and then we'll come back?
Yeah, I'm not going to ask questions as a point of interest, maybe. My first wife, who passed away in 1992, graduated from the Max School of Nursing in St. Catharines. And I'm not sure about this, but I think it was the first nursing school in North America.
Really?
If not the first, it was one of the oldest. Anyway, she graduated in 1957, and they graduated the first male nurse in North America in 1957. One male nurse. I've been in the hospital many, many times since then, and I've been administered to by male nurses.
Oh, yeah.
And several of them. They do a good job. Anyway, that's how long it takes. It may have been, the Max School of Nursing may have been in existence for at least 100 years. And it took that long to get a male nurse out of there.
Yeah, well, and I'm glad the times they were changing. I think in terms of the getting men and women into these fields traditionally dominated by members of the other gender, I always am a little bit frustrated, and I'll share this with you, that this isn't something that everybody finds of more concern. Because, if we just think about it logically, if we want to give women the options of going into fields that men would otherwise go into, like engineering, and I have an engineering background, and there's a lot of aggressive efforts to recruit women into engineering, then to mentor them so they stay in engineering, and to provide them with a warm environment. So there's a rebranding initiative to keep them in engineering. So that means that there's going to be less men going into engineering because we want women to take those spots. So the men have to go somewhere else. So if you're going to move people around, you also have to get men going into nursing and going into early childhood education, going into teaching, or just eject them from the workforce. I don't know if that's what we want to do. But if we're going to sort of rejig this whole system, if you will, then we have to be looking at it holistically. And we don't really do that. We look at, women are not represented in these professions. That's a problem. Let's focus on that. Well, okay, but that's really a part of a bigger picture. So even if really all you care about is the status of women and getting women into those professions, but it would help that project along if you also were interested in getting men to shift over to these other professions, or to be stay-at-home dads, which also have a lot of social stigma still attached to it, but that's improving as well. So I think my larger lesson is, I use the example of professions, but a lot of these areas, these are not zero-sum game. We shouldn't be looking at it as a zero-sum game. We really should be just as interested in giving men more options as we are giving women options, so that everybody can sort of work out for themselves how they want to be a productive contributor to society in whatever way is meaningful for them. So that's my big picture way of looking at this stuff. Yeah.
It just occurred to me with same-sex marriages. It's been 10 years now in Canada, I believe. 9 years? 11. Okay, thanks. Has that changed the outlook on traditional gender roles? You know where I'm going with the question?
Yes, a little bit. It's actually sparked a bit more interest in breaking down that binary way of looking at some areas, for example, violence. Because if you have same-sex couples, then who is the default, victim, and who is the default perpetrator of violence, right? So people have started to look at violence in more complicated ways, and they've actually done studies now that we have data coming from the results of same-sex marriage to see where the violence is. And not so shockingly, there's comparable levels of violence in same-sex relationships, whether it's male relationships or female relationships, or male-female relationships, which again suggests that violence is it's a more complicated kind of thing than just that binary way of male on female violence.
So there's no difference in the rate of violence between
within the relationship. Yeah.
What are the statistics for that?
That's surprising to me.
Yeah, I can send it to John if you want to forward it to the group. I'd be happy to do that.
I found your statistics, statistic on male military deaths.
Mm-hmm.
Do you find that the female contingent moving into combat roles is more fulfilling now?
That by women moving into combat roles, those statistics will change? Inevitably, yeah, they will.
But they're having that?
Well, despite recruitment efforts to recruit women into the armed forces, very aggressive efforts to do that, combat roles still tend to be reserved more for men than women. Not exclusively, but there's still barriers there. Barriers or protection, it depends how you look at that. So yeah, women are less likely to find themselves in those situations of serious combat. And where they do, they're of course just as likely to get hurt because that's fairly random, right? But it's because they're not in those situations as
Hope
often.
they're not in Saudi Arabia.
What's that?
You should hope they're not in Saudi Arabia.
Exactly. Yeah.
I just wanted to talk a little bit about your educational part of the talk.
Sure.
I was a tutor for 15 years, and I had about half boys and half girls. So as a teacher, I knew that was ridiculous, because there were far more boys with problems in school than there were girls. But the reason that I figured out, and I'm pretty sure, that girls are much more willing to accept help, or have their parents tell them you need help, you're going to get it, and boys will put up resistance to that. Most of my girl students were having trouble with math, and most of the boy students were having trouble with language. And I had a great deal more success with the girls, for two reasons. One is that they were willing to accept help, and it seemed to help them to be told over and over again, as I did, there's no reason at all you can't do math. Kept saying, girls can do math. Girls can be good at math. Kept saying that over and over again, and it worked. Somehow, the other side didn't work.
I've done some tutoring myself, not 15 years worth, but a few years, and I do concur with you. I mean, we're trading anecdotes here, so we should acknowledge that. But that's consistent with what I've experienced. I used to volunteer with Pathways to Education, great organization, and they set up shop in socioeconomically disadvantaged communities, and they operate out of schools in the community, and they invite students who are challenged by students who are likely not to graduate, basically, and they try to get them to complete their secondary school education. And we know statistically that men are, let's say, at least as likely as women to need remedial help, probably more likely, but let's just say it's 50-50 would be conservative. And yet I can tell you the numbers of boys actually coming to these programs, it's much less than 50-50, right? And it drops off over the semester. These are programs that they're really sort of mandated to take because they're in danger of flunking out. So they're supposed to be there. These are not completely voluntary programs. And what I see is that at the beginning of the semester, they're close to 50-50, and then within a month or so, that has dropped off quite severely. And by the end of the session, it's quite different from where it started. So again, anecdotes, but they do seem to be consistent that men are not taking as serious the need to finish school, the need to deal with their education issues where they have problems. Yes.
My understanding years ago, the Soviet hockey players came here, and obviously they were good hockey players, but they are also very cognizant of the Russian authors. And I wondered whether if you got some hockey players doing some public service, spots for the libraries, some that are obviously going to college and whatnot, and that would, help with that literacy problem.
That's a great idea. Yeah, absolutely. Having role models that appeal to, your average boy. I know I loathed hockey growing up, so I'm hardly average, but yes, hockey's our national pastime, I guess. So, whatever connects with people. it's not a one-size-fits-all, but if it can help to get more boys and just more students engaged, then absolutely, why wouldn't we try that?
But that idea on its own, to continue on that, just recently there was the It Gets Better campaign, where young children and athletes were coming, and celebrities were coming out about the homosexuality. The one spokesman, the child, 12 years old, committed suicide shortly thereafter filming this commercial. The athletes that had appeared in those commercials found that their careers had slightly altered. And you don't see the commercials on TV right now. As good of an idea as it is, you saw what happened. That I almost died when that kid ended up killing himself. He just filmed himself saying it gets better, it's easier, we're fighting for you, and then he committed suicide. And the athletes that did those spots as well have gone to the media saying that my career is being deeply affected. So yeah, it was great that they did that, but they kind of fell on their swords, and that poor kid died doing that. The men equality might be a bit easier, but that was a really tough campaign.
Remind me of the situation there. What?
This was in the past 2 years. I believe the young boy, 12-year-old Kevin, I can't recall it all, but young boy, he was the first one in the commercial. He came out saying it's okay to be gay, it's okay to say you're homosexual. We're here for you. And then it was in the news, the kid committed suicide. So all these kids that he was allegedly giving hope to, it really rapidly went away, and it's been swept under. Of course, it didn't get better.
Right.
So as great of as a campaign, and it really was a great idea, power to them, but that's how it ended.
Yeah, so there's always the risk of unintended consequences, because once you hold people up as your spokespeople, for a cause, if they fall, then the campaign sort of falls with it. It's a risk. You guess you have to kind of weigh the pros and cons. But I'm glad you shared that. Give us more context on that project.
If you read even the Toronto Sun in the back pages, there's still celebrities, and they're saying the worst thing I ever did was come out of the closet, because they are asking about their homosexuality. A few actors have come out. Christopher Walken has been around for ages, and it's just coming out, and he's really starting to that. And he's been around 50 or 60 years of acting, and it really is hard. They say they're coming out. They're building these campaigns. And they're finding the support mechanisms they had and kind of bailed on them, and they're left kind of, maybe I didn't, and it just gets hushed quite rapidly. And you still read about the ambiguity. Some of the celebrities are using the sexual ambiguity to bolster their career. Miley Cyrus is a current one, and she's skirting with the bisexuality, but when it comes down to it, she's seen dating men, and she uses that as more of a marketing tool rather than a message to young children.
Well, you're not advocating Miley Cyrus for any of these PSA
I'm trying to find a better.
Yeah.
Sorry, it's a generational thing.
Yeah. Good point. Yes.
Female students in engineering school are subjected to more harassment from male students than they should be.
Or than a boy going into early childhood education.
Yeah, and then look at the dentistry school at housing.
Yeah.
I think that some of those men feel very threatened that women are sometimes 50% of their class, and they still consider this a male preserve.
Some men do. I think some men do. Yeah. Yeah, well, those are part of the attitudes that need to change, that men need to change. Absolutely. There's a lot that has to be done. I'm not suggesting that my agenda is the only one, just that it should be a part of it. Okay.
So basically you are looking forward to a more gender-neutral society where equal opportunities, where males and females have the same rights and opportunities.
Yeah, equal opportunities. That's really the focus.
So what about the French that say vive la différence?
Well, that's why I'm more agreeable to the second thing you said than the first thing. We don't all have to end up doing the same thing or being interested in the same thing, but we should have the same opportunities and choices. So if there are barriers, then we don't really have the same opportunities. So if to use the example that Doreen was bringing up, if there are barriers, whether they're actually legal barriers or barriers in terms of the infrastructure of the institution or social or behavioral barriers from the other people in the institution, sending signals that we don't belong. If there are any of those kinds of barriers, those are problematic, and those are things that need to be removed, both for men or for women. At the end of the day, though, once we've done that, you know, it may turn out that women and men gravitate in different directions. You know, we should be okay with that too. We shouldn't force people, you know, out of, you know, areas that are traditionally female or traditionally male, to make some kind of political point. But where there are barriers, that's what we should be focusing our attention on.
If you got rid of the term nurse and plugged in some other term.
Merce?
No, I mean, that completely, that'd be a big division. Because just like the term atheist, there are connotations way beyond the definition.
That's a very good point. That's an excellent point.
If nurses, no more nurses, there's physicians, assistant practitioners, or whatever.
Personal support worker is being faced.
Right. Yeah, that would take a lot of the gender stereotypes away from that.
But that is happening with stewards and actor and actors, but here it is personal support worker, that's being phased in now.
Yeah.
No, PSW is taking
Well,
care
but it's
of
also,
old people.
no, but no, it's also, nurse practitioner is kind of being phased in with, there are different types.
But nurse practitioner has a
Secretary, executive assistant.
It's starting to kind of, administrator is being
Are
assumed over.
they called health service or health practitioners? Anyway, you don't obviously nurse anymore.
Well, that's good, because you see, once you take the gender stereotype out, then you open it up, you open up.
Yeah, I mean, we should, it's a harder thing to do, but we should really be getting at the core problem here, right? And which is, you know, social attitudes. And if by renaming things we kind of raise awareness through doing that.
You'd be surprised how much social attitudes
are tied to that charged word. Yeah, that's an interesting point. Yeah.
I was a teacher, vice principal, whatever, for 33 years, but my son now is finishing his doctorate on instructional design, which is, curriculum is what you learn, instructional design is how you learn it.
Right.
And what he's doing his doctorate on is how we have a factory system of education. It was put into place in North America for factories where you had 40 kids in a room, you had one teacher and and you went from one grade to another, which is not a good way for boys to learn. Girls can adapt to it, but boys find it more difficult, generally speaking. They have more difficulty with language. What Thomas, my son, is working on is how to teach boys in particular language using a completely different instructional design, teaching the same curriculum, but in a different way, so that boys' education and language education for boys in particular will be easier for them because they'll go at it from a different viewpoint completely, and the teacher is doing it instructionally in a different way.
Right.
And this is definitely the wave of the future.
Individualized learning.
Yes, and now he teaches in China right now in an international school, but his curriculums are being used in all of the international schools in the world now. But it's a different phase that education is finally getting out of.
Absolutely. Where was he doing his PhD?
He's doing his PhD through Capella University in Minneapolis.
Okay, interesting.
But he lives in Nanjing, China.
Right. Yeah, I think that's great. I mean, again, giving people different tools and options and resources. The only thing I think we need to be a little bit careful about is if it's individualized to each person, that's great. But we want to make sure that where there are, you know, boys or girls who are not average, right, that they also benefit from these tools. So if there are girls who, you know, find that these tools that are designed for boys help them, and they should have access to them, and vice versa, right? So we don't want to pigeonhole people in any way. But where we can give people different options and just kind of see what works for them, that's a great idea. Sort of experimenting and learning. Are there any other questions? This has been really fruitful.
Yes, we can wrap it up then.
Okay.
Thank you very much. It was really